Behavioral health services are really important to the community as a whole because we recognize that mental health should be equitable to physical health.
These aren't broken bones that we're dealing with. These kind of patients need to be connected with the right resources.
Anytime anybody calls 911 or they call a non-emergency number, the call is going to come into the communication center first and foremost. The call taker is going to essentially triage the call to create the call for service, and then they will be able to pull from the resources, whether it's firefighters, paramedics, or law enforcement officers, to be able to dispatch them to the call for service.
Bernalillo County 911, what's the address of the emergency?
Hi, I don't know if this is who I'm supposed to call, but I need some help.
Okay, and your name?
Charlie
Okay, Charlie, what's your last name?
Thompson.
How old are you?
I'm 24.
Tell me exactly what happened.
I was diagnosed with depression when I was 17. I don't know, but I got these pills. I don't know if I want to take them. I don't know if I should take them. I don't know if this is what I'm supposed to do. I'm sorry. I don't mean to do this. I need some help.
You haven't taken any of these pills, correct?
No, I haven't.
Okay, don't take any of them. Okay, we're going to get you some help. Okay, do you have a weapon there?
No, I don't have a weapon.
Are you feeling violent?
No, I'm not feeling violent.
No? Okay, well, we're going to get you some help, okay? But I need to know if you're going to be violent with my responders.
No, I won't be violent with them.
I'm sending the paramedics to help you now. Salem will tell you exactly what to do next.
Dispatchers are required from the state level to receive mental health training biannually so that we have some tools in our toolbox when we're handling mental health calls. And so we have to recognize the responsibility that we have here in the communication center to try and set those calls up for success from the very beginning.
Behavioral health calls tend to be very different from other EMS calls that we normally run on. We put a lot of trust in dispatch to properly vet the call and relay that data back to us. While we are the ones that go on scene and perform the medical interventions, they are really the ones who make the first contact with the patient. It all starts with communications.
All right, help is on the way. From now on, don't have anything to eat or drink. It might make you sick or cause further problems. Just rest in the most comfortable position for you, okay? All right, so what I'm going to do is I'm going to keep you on the line until help arrives. The process that we go through is we send law enforcement with our medical personnel, okay? So what they're going to do is they're going to go make contact with you. As long as you comply with them, they're going to assist you, okay?
Okay.
I just have to confirm you're not going to be aggressive with them, correct?
I'm not going to be aggressive.
We also have the NM CAL line. It's the New Mexico Crisis and Access line. We also offer that number if you'd like it as well.
Yeah, sure.
So at this time, I'm going to just keep you on the line until help goes on scene, unless you would prefer to be transferred over to the NM CAL line. It's up to you.
I would like for you to stay on the phone, please.
Yeah, I can stay on the line with you until help arrives, okay? So just keep me posted at this time. Just don't take those pills, and just what I'm going to do is I'm going to stay on the line to help you until they go on scene, okay?
Okay.
Okay.
That's the thing, is I don't think that we're just fire anymore. The majority of our calls has to do with emergency medical situations, emergency medical services, and mental health is, on the forefront of all of that. We need to provide the service that's necessary for these patients, and we need to have the training necessary to provide these patients the adequate care.
Engine 30. Rescue 30. Fire control to engine 30,
Rescue 30, 6697 4th Street Northwest, 6697 4th Street Northwest.
It's going to be for a 24-year-old male conscious and breathing, suicidal ideations, Bravo response. Firebox is 300270. Stand by for SO clearance. Negative on COVID.
It's at the park, right?
Yeah, at the park.
Copy. Yeah, I was working. I couldn't really hear the tones. What are we going on? Looks like we have a 24-year-old male, suicidal ideations. Looks like we're gonna have to stand by for BCSO to clear the scene. All right, I know where to stand by.
Well, usually every single call involves multiple agencies. So myself with HopeWorks, Detective Birch in the Bernalillo County Sheriff's Office, as well as deputies who go on scene first to, secure the scene for our safety, as well as the Bernalillo County Fire and Rescue. Obviously, we'll come into the call to make sure if there's any medical needs for the patient, and we all have to work together and collaborate for the best care for the patient.
We really need to, try to understand what the patient's going through and try to have some empathy and, understanding, and try to give them the best care that we can provide. The biggest thing is we don't want to escalate the scene into a situation that is not necessary. It's really easy to make somebody feel uncomfortable and to put them on their guard. So, our job is to go in there and make them feel at ease, make them feel comfortable, and to try to get as much information out of them as we can so we can take that information and then put it back into finding the appropriate resources necessary to help them.
You never know how much you will miss the sun until your whole world is covered in darkness. I don't know really what stopped me. I think it was the thought of leaving my son behind without a father. Someone to come to his aid, make his life better like Mom did for me. I guess I just needed somebody to come save me from myself.
If you are in a place where you are navigating the next step and not really sure where to turn, recognize that there is always help and always resources available. The Department of Behavioral Health Services is currently funding a wide array of behavioral health supports. Those services range from peer case management, peer drop-in centers, youth transitional living services, training and education, mobile crisis teams, law enforcement assisted diversion are just a few of the many programs that we're currently funding. The Behavioral Health Initiative has brought these programs forward. We encourage anyone who is needing supports for themselves, for a loved one, or maybe a peer, that they immediately go to our website and look for those resources and ways to connect and get help. The Department of Behavioral Health Services is changing lives.